Good evening or afternoon. My name is Dr. Winston Price. I'm the past president of the National Medical Association and also the Chief Technology Officer for the W. Montague Cobb NMA Health Institute. I'm delighted to have you join us today for an exciting webinar. This is a continuing series that is sponsored by the Department of Health and Human Services and also co-sponsored by the Montague Cobb Institute and hosted by our ongoing key partner, blackdoctors.org. The Risk Less, Do More webinar is part of the Department of Health and Human Services respiratory virus public education campaign, and we want you to risk less, do more, as the logo says. And it's to seek to inform the public about influenza, COVID-19, and respiratory syncytial virus and their vaccines. The campaign aims to motivate higher uptake of the flu, COVID, and RSV vaccines during this 24-25 season, reducing the public health burden of these diseases in individuals, families, communities, and the nation overall. Additionally, the campaign will increase public confidence in the flu, COVID-19, and RSV vaccines and cultivate vaccine literacy to enhance the awareness of the vaccine accessibility, particularly for vulnerable populations and communities. If you want more information about this other than this webinar, you can go to risklessdomore.hhs.gov. Now, as I mentioned, this webinar will explore how public health departments play a pivotal role in promoting vaccine access and education within communities. This engaging webinar will feature expert speakers discussing strategies for increasing vaccine adoption, addressing barriers, and building trust to improve community health outcomes. And we'll talk about vaccine outreach, particularly in pregnancies and maternal health. We'll talk about the senior population and also building that trust in trusted voices in underserved communities. I am particularly thrilled that we have two dynamic presenters today, not in order of priority, but Dr. Dial Hewitt is a medical director in the Division of Diseases Control and Chief of Tuberculosis Services for the Westchester Department of Health. He's a graduate of the University of Wisconsin School of Medicine. He is board certified in internal medicine and infectious disease. Dr. Hewlett completed his residency and served as chief medical resident at Harlem Hospital Center in New York City, followed by a fellowship in infectious disease at Montefiore Albert Einstein Hospitals. He previously led the infectious disease division at Lincoln Hospital Center and worked in the pharmaceutical industry. He is a fellow of the American College of Physicians, Infectious Disease Society of America, and the New York Academy of Medicine. Dr. Hewlett consults at Calvary Hospital and is an adjunct associate professor at the New York Medical College. Welcome, Dr. Hewlett.
Thank you for having me.
And we're also going to be delighted to have Dr. Michelle Taylor. She earned her undergraduate degree from Howard University, one of the prominent HBCUs, her MD from East Tennessee State University, and a master's in epidemiology from the University of Tennessee Health Science Center. She holds a doctorate in public health from Johns Hopkins, or as they say, the Johns Hopkins University, and a master's in public health administration from the Harvard Kennedy School as a Commonwealth Fund Fellow. She's a pediatrician and a lieutenant colonel in the Tennessee Air National Guard. Thank you for your service. Dr. Taylor has served in various leadership roles, including Associate Medical Director for Maternal and Child Health at Shelby County Health Department and Division Chief for Aerospace Medicine with the Air National Guard Surgeon General. Since 2021, she has been in the Division Director for the Health Services for Shelby County Government, overseeing that key public health programs and services and enforcement in Memphis, Tennessee. Welcome, Dr. Taylor. So what I'm going to do to start us off with the intro about the invaluable program is I'm going to ask Dr. Hewlett to just give 5 minutes intro about the significance of this 2025 season and why public health infrastructure is important as we move forward.
Okay, certainly. As always, when we enter the respiratory season, as we call it, we expect to see an increase in cases of influenza. And also we see respiratory syncytial virus cases increase. And since the pandemic of COVID, we also expect to see increases in cases of COVID. Fortunately, since a large percentage of people have been vaccinated against COVID, we are not expecting to see as much in terms of a spike with COVID. However, we still are urging people to have the COVID vaccine as well as the influenza vaccine. And most recently, and I think we can talk about this during this discussion, we are encouraging our elderly individuals over the age of 65 to have the RSV vaccine as well. And I think that certainly Dr. Taylor will probably be discussing some of the issues around pregnancy and the vaccines that are going to be administered during pregnancy. And we are actually encouraging our young women who are pregnant or who are contemplating pregnancy that they have these vaccines as well. And there is a lot of new information specifically around the respiratory syncytial virus and how this being the first vaccine, the first time we actually have a vaccine that is approved for use in the mother for the purpose of protecting the unborn child. So it is a very important time that we're approaching, and I think a very interesting time, but I think we have some tools that we can use where we need to educate people about this so that we can actually protect people more effectively as we go into this respiratory season.
Right. Same question, Dr. Taylor, with emphasis on maternal and child health. As we know, there's been a lot of fanfare about women's rights and the rights of children. So from your perspective in terms of the public health importance of bringing the right message to the communities.
And I'm sorry, Dr. Price, I was having some sound issues. So if you could repeat the question, that would be wonderful.
Right. A general statement by you, not necessarily a question, but to emphasize the importance of the public health infrastructure as we move forward. We're going through a change of administration when we need to make sure that we have a strong message to our communities with regard to the importance of vaccines and vaccines infrastructure.
Oh, absolutely. So I bring you all greetings from Memphis, Tennessee, and it couldn't be more important to have a strong public health infrastructure, especially when we start to talk about populations who really need these services and really need vaccinations and accurate information about vaccination. Like Dr. Hewlett was sharing, it's really important to get the messaging right. Our folks come into the Shelby County Health Department and they expect to be able to get the vaccinations that they need. And when they have questions about those vaccinations, they expect to get the right information about those vaccines so that they can make the best decisions for themselves and their families. As you know, a lot of pregnant women are always hesitant about getting vaccines during pregnancy. They have a lot of questions about, well, can I get it during the first trimester versus the third trimester? But what we always tell people is that, listen, these vaccinations are safe and they're not only protecting you, but they're protecting your baby even before the baby is born. The advances that have been made in vaccinations, especially around RSV, are wonderful. I remember training in pediatrics where we were trying to figure out how better to protect kids against RSV during the winter season, especially, and during cold and flu season. And so now to have a vaccine that a pregnant woman can take that will also confer immunity to her baby couldn't be more important. And it just is a testament to how many millions of lives have been saved by vaccinations overall. And so having that strong public health infrastructure and having the people and the expertise in place to be able to continue these services and be a trusted voice, especially as we change into a new administration, couldn't be more important.
Great. Thank you. Thank you for those comments. And so even when we went through the pandemic, we realized that vaccines themselves don't save lives unless they get into the arms.
That's
And
right.
so, Dr. Hewlett, considering the distribution issues that we had during COVID, where vulnerable populations, particularly those in long-term care facilities, didn't have the same access to the vaccines, the life-saving vaccines, as we go into this season, what strategies are in place to make sure that the inhabitants of the long-term care facilities are receiving the vaccines, particularly the newer ones for RSV?
Well, I am not sure that we actually have adequate strategies in place. I certainly wish that we did. If it was left up to me, one of the things that I think we would start with would be an information campaign with information directed towards those who are charged with operating the long-term care facilities and nursing facilities, assisted living facilities, educating them about the importance of these vaccines and encouraging them to make sure that the vaccines are available for their patients. Now, unfortunately, you have differences as you go from one state to another in terms of what the individual facility is able to provide or what they're required to provide. And so it's very difficult and challenging, but I think the information is really a big part of it. The other part, of course, is making sure that the families of the residents are made aware of what's needed, in addition to obviously the residents, because many of the residents may not be the decision makers themselves. And I think the other thing is making sure that we have some trusted messengers. And so the doctor and the nurse may not necessarily be the best trusted messengers. And we have to think about who are going to be the best people to convey that message to the families of the residents as well as to the residents themselves. So this is something that is still, we need to do a lot of work. And I think especially when it comes to respiratory syncytial virus vaccine, that's going to be sort of our next big hurdle. I think with influenza, that's a much easier hill to climb.
Sure. And Dr. Taylor, the Cobb Institute emphasizes building trust within communities, but how can we effectively address vaccine hesitancy and misinformation specific to long-term care facilities?
Well, like Dr. Hewlett shared, a lot of it is really training the providers and the trusted messengers on how to get that message out there. And then it's about executing. Here in Shelby County, one of the things that grew out of the COVID pandemic is that we were able to take over from the city of Memphis a homebound program where seniors could call and make appointments for our nurses to come out to give them COVID and flu vaccine if they couldn't get out to one of our locations. And because we have built that trust in the community around other services that we provide, then it was a natural fit for our nurses to go out and give those vaccines. The same thing could be done in those long-term care facilities. We do a lot of that work anyway. On the other end of the age spectrum, back to school season is a big time for us. And most of it revolves around giving those vaccines. So you would institute the same idea with long-term care facilities where you have these big celebrations events. You bring different community partners in who are providing all kinds of services for seniors. And then you have vaccines there as well. And at that point, you're educating about the vaccine and really encouraging people to get it in real time while they're seeking these other services and information about everything that is available to them in the community. We, over the summer, did a model like that where we called them community care fairs. And we basically took all the services that we provide in the health department that were mobile to be provided and dropped them down into different zip codes. And people have really responded. And so with long-term care facilities, there's nothing that would prevent us from doing something similar. But it really starts with getting the providers and the messengers involved and saying, here, let's do this. You know these people well because you work with them every day. What kind of services do we need to bring in so that we can have almost like a one-stop shop for them?
And Dr. Price, if I can
Yeah.
piggyback on to what Dr. Taylor was saying, one of the things that we're running into here in the New York area and in our county is access for our population. The COVID vaccine, for example, we were doing mass vaccinations at our health department. And the very thing that Dr. Taylor discussed in terms of going out to the various facilities, we actually had some of the EMS teams going out and vaccinating people in long-term care facilities. Now that the government is not providing the vaccine, we are unable to do that because we are told our health department's budget doesn't cover that. One of the other things that's a worry for me, and this I think is something that everyone should be aware of, is that the pharmacies, many of the commercial pharmacies are closing facilities in the underserved areas. And many of our older patients don't have transportation. And so it becomes a challenge for them if they have to leave their neighborhood and go out to some other place in order to get vaccinated, because if the health department's not administering the vaccine, then where do you go? We actually had freezers and other ways of giving the vaccine, and we actually had designated pharmacists. And where do they go now? Because the usual physician doesn't actually stock these vaccines. So that is the challenging part.
Right. And the same with some of the shut-ins who are in the elderly population. What additional strategies can we put in place to get vaccines to them?
Yes.
So we need to work on those. And I know the Montague Cobb Institute is working on pop-up clinics in several vulnerable communities. And the more we can do that, the better we will be. And also utilizing the expertise of even medical students and nursing students, nurse practitioners and PAs to get them out in the community through their medical institutions is another way to bring vaccines to these vulnerable populations.
One other thing which I'll mention is that sometimes we have to think about some other ideas. And I think that this is an ideal time to think about how we can collaborate with our colleagues in the pharmaceutical industry. Because yes, we know that it's a business, and yes, we know that they're in the business to make a profit, but I think that we also have to make them aware of the fact that there are many unmet needs in our communities, and they may be able to pitch in and assist us in some of these areas where the vaccines are so badly needed.
Okay. Well, let's shift to vaccines during pregnancy. And I know, Dr. Taylor, you alluded to some of those ideas, but with the ongoing concerns about vaccine safety, and of course, people now are more concerned about the side effects from the vaccine other than the diseases we're trying to prevent, because they haven't seen a number of the diseases that we've been able to eradicate or near eliminate. But with regard to COVID-19, with regard to RSV, with regard to the flu, what kinds of effective ways can we communicate the benefits and the risks of COVID-19 vaccination for pregnant mothers and their partners? I'm sure you've heard a lot of mothers saying, I don't want to get the vaccine because I'm pregnant, which is contrary to really protecting that infant.
And I think it really is about meeting people where they are, and trying to alleviate some of those fears. I always tease people. I was a pediatrician first in this medical world, and a lot of my job revolved around making sure parents felt comfortable to get vaccinations, right? And making sure that if I had families that came in that already had children, but mom was pregnant with the next one, explaining to them why vaccination was so important, not only for the pregnant woman, but everybody who was going to be around them. And so I think, a lot of it is about centering the family, explaining how everybody in the family needs to be safe, and then taking the steps to make sure that everybody in the family is safe. One of the things that we do here in Shelby County a lot of times is if we are going to have a back to school event, we always make sure that we also have vaccines in place for those parents that may need vaccinations when they bring the kids in to do it. And parents are always really, really thankful for that because they understand that if it can be more convenient for them to come in and get that shot at the same time their child is getting the shot, then it's one less thing that they have on their list that they have to do to protect their family. So I think a lot of it has to do with talking about families in a holistic manner. Just like I would have talked to mothers and grandmothers about, holidays are coming, there's a new baby in the home, everybody needs to wash their hands before they handle the baby. It's a perfect opportunity to talk about everybody needs to get vaccinated before this baby even comes out, right? And a lot of people say, you know what? I never thought about it like that, but that's exactly what we need to be doing. One last thing, you're right to say, a lot of people who are being trained as providers right now have never seen some of these diseases. And that extends to the population as a whole, right? So if I went back into the hospital now, there are interns and residents there who've never seen a case of chickenpox outside of a book, right? Who've never seen a case of polio, right? I had never seen a case of polio outside of a book, right? And so it's hard to be afraid of something if you've never experienced it, right? And so a lot of it is about doing that type of outreach, helping people to understand that these are real people. This really happened. Just because the picture is grainier than what's on your phone doesn't mean that this didn't happen and this isn't what we're trying to protect against, right? And so it's really getting down to that granular level and helping people to understand, okay, you hear a lot of information out there. Not all of this information is accurate. Just because it's on TV or on social media doesn't mean it's accurate. Let me explain to you what this really means and do it with kindness, right? Because people don't want to feel like you're talking down to them, right? But just do it with kindness and say, listen, this is what I'm trying to protect you against. This is what I believe will work for you and your family, and then let them make the decision.
Absolutely. Very, very good point. And Dr. Hewlett, as an infectious disease specialist, we've gone the route over the last 4 years with misinformation and disinformation. What resources can healthcare providers utilize to stay up to date with the latest recommendations for COVID-19 vaccines and the RSV, that has different guidelines for infants, from pregnant mothers, from the elderly? Where should they go for information, and where should they go for trusted information that they can share with their patients?
Well, for me, I think that the tried and true source is the Centers for Disease Control, the CDC website. And this website is updated very frequently, sometimes over a period of 2 or 3 days. There's new information there about all of the different vaccines. And there are guidelines there, recommendations for how to use the vaccines in the various patient populations. So whether it's pediatrics or adults, senior citizens, individuals who are immunocompromised, I think that practitioners can find the information that they need in the CDC guidelines. Of course, there are other specialty guidelines that people can look at as well, such as the American College of Obstetrics and Gynecology. They certainly have guidelines as well, specifically aimed at answering questions about vaccine use during pregnancy. But I think that this is probably the most straightforward and easiest way to source information. And if I can add one other plug that Dr. Taylor touched upon, it's very important for us to listen to what the patient is saying, or listen to what the parent is saying, or the loved one who has a parent that cannot speak for themselves. We have to listen and understand their concerns. I had a discussion with my daughter earlier this afternoon, and she actually just had our second child, and she said, "Dad, I'm for vaccines, but one of the things that happened during the pregnancy was she was told about the flu vaccine, and she just asked the question about, well, I want to know about the safety. She said that the practitioner immediately became very defensive and judgmental. And that was a turnoff for her, even though she received the vaccine. But she explained to me, she said, well, if I was a person who really did not want the vaccine, then this would have really turned me off. And I think that we as practitioners have to understand that the way in which we approach this is very important. And as Dr. Taylor said, we cannot talk down to people. We have to listen to them, and we have to try to meet them where they are. And I think that that's really going to be essential as we are entering this respiratory season.
Right, right. And the Montague-Cobb Institute emphasizes racial and ethnic health disparities, and we know that there was some element of mistrust related to research or non-research, however you want to view it, years ago. And many of the individuals who are citing that as a reason to not trust vaccines weren't part of that. They don't have the lived experience of what actually went on with that. How do we get that out of our mindset as we educate parents and families about the importance of vaccines? How do we do that to eliminate the disparities?
So I'll start with this one. One of the things that I did, especially at the height of the COVID pandemic with parents or just people in general who were parents, I would explain to them that, I started out as a pediatrician before I came over to the public health world. And I'd say, okay, do you have any kids? Yeah, I have, 2 or 3. Okay. Did your kids get vaccinations back in the day? Oh, yeah, they have to have vaccinations to go to school. Okay. Well, tell me about the visit. What happened during the vaccination? Do you remember, whenever the child got ready to get vaccines, did they hand you a package of papers that explain the vaccine? Yeah. They would always hand you a whole bunch of papers and then the child would get the vaccine. Okay. What'd you do with those papers? Did you read them immediately before you let them give the child the vaccine? Well, no, I usually would fold it up, put it in my purse, put it in my pocket. Exactly. So the papers that you're getting for the COVID vaccine are really not any different than the papers that you got for all those other childhood vaccines that your child got to start kindergarten or to go to middle school. So if you folded up those papers and didn't ask any questions, and I'm not judging you, right? Because I said I did the same thing and I'm trained, but I honestly know what's on those pieces of paper. I said, if you went home and compared those papers to the COVID vaccination papers, they are very similar. I said, COVID may have had a few more pages because it was newer. Very similar. And then I would take the time to teach about what research really means, what lists of side effects really mean. The fact that even if 1 million people didn't have the side effect, but one person did, they have to put it on the paper. People need to understand that, right? Because if they haven't been trained and nobody has ever taken the time to explain it to them, then they don't know what to believe, right? But when you brought it to that basic example, then I had a lot of success with combating vaccine hesitancy, and my staff did too, right? But we also know from the literature and anecdotally that people tend to trust providers that look like them more or who have similar lived experiences as them, right? And it's harder it's not impossible, but it's harder for that provider that may not have that lived experience, that may not look like that patient, to really bridge that gap. It can happen, but providers have to be intentional about that and understand that, like Dr. Hewlett said, you can't get defensive. Even if you feel it in your spirit, you can't get defensive. And you have to meet that patient and actively listen to what they're telling you. I always like to tell my staff, you don't know what people bring through the doors with them when they're seeking services. And
Absolutely.
the way they behave, there's stuff in the background that you don't know about that has nothing to do with you, right? And so we have to remember that, and we have to remember to be kind. And we have to remember that even when our clients, our patients, our customers aren't kind, we still have to be kind because we have a job to do and we need to make sure that we're providing the service that will help them protect their health. So I think, a lot of times as providers, we have to kind of do a lot of self reflection to be prepared to provide those services in a way that will be meaningful for our patients.
Absolutely. And part of the task that Montague Cobb Institute was given early in COVID-19 was to dispel some of the pushback with regard to, is this vaccine safe for me, for my people? And so early in the game, fortunately, um, through the leadership of Dr. Randall Morgan, we had those pharmaceutical companies coming to us to say, help us get these patients enrolled so that it helps the clinicians be able to say, not only is it safe, but X percentage of individuals who look like you were involved in the early clinical trials to show that the vaccine is not only safe, but effective. Now,
Yes.
in terms of seniors who are at higher risk, let me ask this question, and either you can answer. Um, there are the recommendations for a number of other vaccines. I know we're focusing on COVID and influenza and RSV, but they are at risk for a number of other respiratory illnesses that require them to get vaccines. How do we package that for seniors to make sure that they're getting all the vaccines that not only they should have, but that they're entitled to get? And I guess where I'm alluding to is, we know that we have higher acceptance rate for vaccines when they're mandatory, when they're required. We understand we went through COVID and we know that there was a lot of pushback by certain groups when we said you must get the vaccine. But are there strategies that we can use to get these vaccines for illnesses that we know are causing a lot of harm to a required vaccine in certain communities?
Well, maybe I can start. Certainly in our older population and in people who are immunocompromised, we want to make sure that these people are being vaccinated. The good news is that we can actually give 3 vaccinations at the same time if we have to. And in our health department, our strategy is, when we have a person in front of us, or if the person is in a nursing facility, you try to do as much as you can while you're there, because you may not have another opportunity. And so there is safety information available and tolerability information available to support the administration of up to 3 vaccines at once, which would include, of course, the updated COVID vaccine, the RSV vaccine, and the influenza vaccine. For the older population, I think that all of us agree that for people who are 65 and older, they should actually get the vaccine that is formulated specifically for the people in that age group, which is sort of a high test version, you might say, but it actually does offer a higher level of protection for older individuals. The other thing which I think we have to be aware of is that people who are in facilities are more likely to be exposed to someone who has one of these types of illnesses, especially RSV. It has been shown that RSV can just sort of go rapidly through these institutions. And so for that reason, it's very important for us to encourage people in these closed congregate settings to get the vaccine. So these are some of the things we want to sort of keep in mind as we're approaching this.
Right. And of course, we don't want to forget our individuals who are in shelters or who are homeless,
Right.
who are
And
incarcerated population,
I'm
they
glad
too
you
deserve the
mentioned
vaccine.
that. We did have we had a grant from Health and Human Services from 2021 until 2023, and it was a health literacy grant. And one of the things that we put into that grant was that one of the arms was to educate people who were incarcerated. And in our county, we have a jail population, and people are not in the jail for a long period of time. However, when they are there, they're congregated together. Many times people are there and they've been charged with something, but they can't really get out because they can't post bail. So they've actually done nothing wrong. No reason for them to actually be there. But be that as it may, part of our education program was to educate people who were residents of the facility, as well as we attempted to educate the people who were the guards or the people who were working there. And it did work quite well. We were able to convince the residents more often than the people who were the security people to have their vaccinations. And when we told the residents that the security people were not being vaccinated, they said, well, we have to protect ourselves against these people. And so we all want to be vaccinated. So, but you're absolutely right. We want to make sure that they know. And then the other message that we gave to the resident inmates was, we want you to have these vaccinations because when you are discharged, we don't want you to take disease that you may have gotten here in the jail back to the home where you are going to be going. And the homeless population is really a challenge. Our health department is right across the street from a homeless facility, and it is a challenge, but certainly if we can take the vaccine to them. And one of the things that is effective that I think Dr. Taylor touched on is if you can have like a food pantry kind of an activity going on at the same time that you're giving the vaccines. This serves as an incentive. So we have transient populations, and if they know that there's a food pantry activity going on, which they have regularly, we can station ourselves there and offer the vaccines at that point.
Right, right. And we've had challenges with the RSV vaccine, Dr. Taylor, with regard to two scenarios. One, the OB departments are not getting the vaccine in order to vaccinate the mothers by the 36th week. And then when the infants come out of the hospital, many times those who are on the public assistance insurance programs haven't gotten the paperwork when they come for that 4-day, 5-day follow-up. And so many times we don't have the criteria to use the VFC vaccine. What can we do, and what have you done to try to get around that barrier so that we can protect these kids early in life?
Well, we have a program called CHANT, which is a community health navigation team that we have out of the Shelby County Health Department. And they work with the local hospital and local providers to make sure, especially those under-resourced families, are getting those benefits that they should be getting through VFC. So that's, a lot of that has to do with really policy advocacy, making sure you're not allowing people to fall through the gaps, because that's really what happens is they fall in that gap. They know they haven't gotten the paperwork. They're definitely eligible. And so a lot of times our navigation teams and really our immunization team as well is checking, double checking, triple checking to make sure that these families can get those vaccinations out of the VFC program. I'm happy to say that we try to do a really good job not to let that happen. Of course, you're going to have a few families that you may have to bring back because of paperwork delays. But a lot of it is just awareness of the policy and making sure families get what they need.
Right. Yeah. Yeah. I've challenged my staff. I told them, bill me, go ahead and give the vaccine and bill it to me. But fortunately, they, by a week and a half to 2 weeks, they have all the paperwork.
That's right.
Yeah. But, you can't have the premature infants coming out and telling them that we can't give you this protection because paperwork's not done.
That's right. That's just not acceptable. Absolutely. And, at least in our region, we are very blessed to have a county hospital that has a very active NICU, along with a children's hospital that does a lot of work with St. Jude. And so they are experts in navigating that gap. And then they lean on us, like I said, and our health navigators to make sure those children are taken care of.
Right. So are we clear that the politics of health will at least remain stable in terms of accessibility of vaccine as we go through the new administration? Because, we're already struggling currently with inadequate amounts of the vaccine for pregnant women. And we certainly don't want to see, when we get to the peak of RSV and influenza, which is coming very shortly, that certain communities don't have access to the vaccine. Where do we put that pressure, particularly with the upheaval in the Department of Health and Human Services and CDC?
Well, I think that it's incumbent upon us, that is, medical societies like National Medical Association, other medical associations, the other association I belong to, the Infectious Disease Society of America, to actually have some proactive types of messaging, which is nonpartisan, basically just stating that these vaccines are essential if we're going to maintain health. I mean, here in our county, 2 years ago, we actually had a case of polio. And so we really do not want to go back to the 1950s, even though I know a lot of people think that they would like to live back in those days. From a health standpoint, we really don't want to do that. So I think that that's one of the things that we need to do, and to continue to educate the people that we are serving. But I think especially for us, in the African American community, I think that we are the first ones who are going to be hit by this. And we know that there are going to be a lot of economic pressures in our health department here in Westchester County, New York. We already have been feeling the budget cuts because they started to make cuts in advance, anticipating that next year we're going to have less money than we have now. And unfortunately, we aren't even able to offer the COVID vaccines in our health department. People call our health department and they say, I'd like to schedule a COVID vaccine, and we have to tell them that we can't provide it unless they are without any kind of coverage whatsoever.
Right.
So we have a challenge, but I do think that we need to be proactive, and we need to be drafting some statements right now to appeal to say we need to have maintain the funding that we have for vaccinations.
Right. And more faces like those of the two experts I have with me today need to be there in Congress, giving these facts and figures and importance.
And one thing that we did too is we have a lot of people may not be familiar with this, but there's health advocacy days that we have had on Capitol Hill. And I didn't know too much about this, but about a year ago, I participated in this, and it's actually a very gratifying experience.
Absolutely.
And I think that we should encourage our colleagues, as many as possible. We know that it's an inconvenience to go to Washington, D.C. It's easier for us here in this part of the country. But I think that showing up at your congressional person's office, even if it's locally, does have an impact if they actually see you there in their office, even though the staffers are the ones that are taking the information. So I think this is another tool that we need to use so that we can try to maintain support for our communities.
Right.
And it's about reminding, especially elected officials, how strengthening the public health infrastructure, making sure that the local, state, and federal level are taken care of and shored up, means that economic development keeps going, right? Because you really can use the COVID pandemic to the end of time and say, sick people can't go to work. Sick children can't go to school, which means academic performance is going to be off. Businesses are going to fail. Things are going to happen. But if you are vaccinating people and protecting the health of your population, you're protecting your economy as well. And So, really framing that for some of these folks is really important. The other thing I'll say is that, I've had to really discuss with my staff about the fact that because we are a blue county in a red state, we've been operating in this type of environment for quite some time.
Okay.
And so we are well positioned to understand how we need to be looking at our budgets, what we need to be prepared for, right? How we need to be talking to our local officials saying, hey, if state dollars or federal dollars get cut, we may need to come to you for a few more local dollars if you would like these services to continue. So it's really about strategizing around what your budget is going to look like. Like Dr. Hewlett was saying, you've got to be prepared for that scarcity that may come. Also understanding, though, that there are a lot of people who are ready to advocate, who are ready to go to Capitol Hill and say this has to happen, right? And there are a lot of people who understand how to navigate with their local officials and how to describe it in terms of not only lives saved, but money saved. And, some providers don't feel comfortable with that conversation, but that may have to be how we couch it if
Absolutely.
we plan to continue to save lives.
Absolutely.
Because it really is about the economy as well.
And as you talk about the economy, how can we promote international cooperation and collaboration to address some of these vaccine inequalities?
Oh, wow. What a question.
Yeah.
Dr. Hewlett?
Yeah, that is a tough question, but I think
Yes.
that what we have to make sure people understand, I think, and in this day and age when science is being challenged, we have to make people understand that viruses do not respect borders.
Right.
They cross the ocean very quickly, and they don't respect state lines. And a virus that is in one part of the world in Asia can be in California and New York within 8 hours.
Right.
And so we have to keep that in mind, and our public officials need to keep that in mind. I think we also need to, and this is another challenge, we have to continue to have a dialogue, a constructive dialogue with the leaders of the other countries around the world. And if that dialogue stops and we don't have the kind of protection that we need, then that's going to be a problem. And so just like there are problems with different types of war and everything else going on, I think that the viruses are something else that can actually attack our population if we are not prepared with our infrastructure.
Yeah, definitely. And as we are trying to secure our borders, if you will. We're trying to keep populations out, but we know that there's still a lot of international trade that comes with the possibility of infected material coming into the country. In particular, as we chatted prior to the webinar about some of the recalls that have been occurring, one wonders how much of the international food coming into the country are skipping through some of the checks and balances and getting infected before it gets to our country. So we need to make sure it's funded.
One other thing which we should add, and I keep putting plugs in about support from industry. I think that this is one of the places where industry can help us, because we know that in many of the underserved countries, they cannot afford vaccinations. They cannot afford some of the basic medications. And I know that sometimes our industry colleagues will step up and they will provide these resources for underserved and under-resourced countries. And by so doing, this actually helps us here in this country. And this is another message that we have to try to get across. This is the kind of thing that if you go to Capitol Hill or you're speaking with your congressperson, they have to have that understanding that in their minds that they're saying, why are we sending all of this money to this country? It's actually helping our country as well. It's not just for them, it's also for us when we talk about communicable diseases.
So it sounds like you're recommending that vaccine preventable diseases should be part of the portfolio for every billionaire in a foreign country.
I think so.
If they would like to continue to operate, they should.
Absolutely. Well, we're coming up to 10 minutes before our conclusion. So 2 minutes, Dr. Taylor, tell us your key points that you want our interested audience to know from today's webinar.
Key points: active listening for your patients, your population, the people that you're serving, to make sure you can meet them where they are. The other thing I would say is that it may seem dark right now as we go into this next phase of health and healthcare and public health in our country, but we also know that we have a job to do and that we're going to continue to do it. And so I think what you heard today is that we have the expertise, we have the knowledge, we have the know-how to get this done. And it just means that our messaging may change a bit. Our tactics may have to change a bit. But at the end of the day, if we continue to save lives, continue to get people vaccinated, continue to serve the people and the populations that we know we need to serve, then it will have been worth it.
Great. Excellent points. Dr. Hewlett.
Yes, well, I echo all of Dr. Taylor's statements there, and I agree that it is a difficult time that we are entering. One of the things that I firmly believe, though, is that we certainly have been blessed to be able to serve as physicians responsible for the health of our fellow humans. And I think we can never stop doing that. We always have to be providing this service. And one of the most important services I think that we can provide for our patients and for the families and for everyone else is to make sure that they are educated, making sure that they are given objective information about how they can stay healthy. And of course, vaccines is really just one part of that. But I think we have to keep doing that. One of the things which we didn't really mention, which I'll mention now, is that the approach that we take to the patient who may be hesitant about vaccines in the office type setting or in the clinic is we don't say to the patient, would you like to have your flu vaccine today? What we say to the patient is, well, it's September and I'm going to give you your flu vaccine. And the patient, put the patient into a position where they actually have to refuse, not into the position where you're making it an option for them. I think that that's very important. And we have to make sure also that we are not being judgmental, that we're not talking down to people, and that we are trying to meet them exactly where they are. And if we don't succeed on that first visit, we have to say, well, maybe the next time we will be able to be successful. And the other thing which I try to emphasize for some of our patients is, well, you know, with communicable diseases, it's different than your hypertension. When you don't take your hypertensive medication, if you have a heart attack, I mean, everybody's sad, but it's you. If you don't take your flu shot and you get the flu, then everybody in your house is going to get the flu as well, or everybody in your house is going to get the COVID as well. And some of them might end up in the hospital, just like you might end up in the hospital. So I think we try to emphasize that as a difference as far as communicable diseases.
Right. Well, this webinar has been very informative. I've learned a lot from our two experts. Our audience has been entertained by a number of issues and strategies that we've elucidated with regard to RSV vaccine, the flu vaccine, and the COVID-19 vaccine. And we threw in a little bit of tidbit about other senior vaccines that are important. But the key with the mantra of this HHS education campaign is to risk less and do more. And we know that many of these diseases are indeed killing people, leading to harm not only to individuals, but to families and communities. And with limited resources, we want to make sure that we minimize the impact on communities in terms of the economic impact of all of these three diseases. And as many have said over the last several years, the next pandemic is just around the corner. And so our ability to put into effect key strategies to minimize the impact on vulnerable populations, to populations that were harmed disproportionately during this global experiment called COVID-19, we want to make sure that we use all of these strategies to their max to make sure we can at least tackle these diseases that are right in front of us to prepare us for the future. And there are pockets in this country, particularly the vulnerable infants and maternal population. We know that Black women are 3 times more likely to die during pregnancy. And so these kinds of diseases that we can prevent to improve the health of these women and their offspring are things that we need to put into effect. And then maybe somewhere down the road, all of these vaccines will be accepted in the general population as mandatory vaccines to help protect the health and well-being of our country. And so I want to thank Dr. Michelle Taylor for leading us in the discussion with her expertise, Dr. Dal Hewitt with his ingenuity and infectious disease expertise. I want to thank the Montague Cobb Institute, the Department of Health and Human Services, and our key strategic partner, blackdoctors.org, for allowing us to promulgate this information across the nation. And we will continue to do this outreach as effectively as we can to make sure we're bringing critical information, truthful information, and following the science. So thank you all for your attention and have a wonderful holiday.
Thank you.
Thank you. Good night.